Andre with the University of Maryland Capital Region Health, and welcome to our Ask the Expert Facebook Live session, where today we're joined with Dr. Craig Person, who will be discussing how to get your best summer body. Dr. Person is a plastic surgeon for the University of Maryland Capital Region Health Medical Group. Thank you for joining us today.
Pleasure.
And thank you to all viewing right now. We invite you to submit a question during this live segment by submitting a comment below. Please let us know you're watching by liking this video or our Facebook page. Dr. Person, it may not seem like it right now with the weather today, but summer will be here before we know it. And a lot of people are finding that their New Year's resolution to lose weight and get in shape hasn't delivered the results that they wanted or expected. Is there anything more people can do to ensure that they are summer ready?
Yes, that's a great question, DeAndre, and really where the plastic surgeons come in. There are a number of surgical procedures that plastic surgeons offer that will contour the body and help it get beach ready. Those procedures can vary from typical procedures that you might know, such as liposuction and tummy tucks, to other procedures including implants.
Okay, great. So if someone is thinking about having cosmetic surgery, when's the best time usually to get it and why?
Well, the big thing is you want to be ready for the beach season. So as I like to say to patients who had tummy tucks, you'll look much better in 2 days, but you won't be able to move. So our usual rule of thumb is that patients should get things done really now, so they have almost 2 months to recover. So not only will they look better, but they'll be able to act natural, and the results will look natural. And also this time of year, you can also wear layered clothes, which will help camouflage the healing period.
Great. So what are some of the most common procedures requested by your practice right before the spring and summer months?
Gotcha. Excellent question, and this is the time for that. As you might expect, the procedures I think that jump to everybody's mind initially are liposuction, breast implant augmentation, tummy tucks, but we also do a number of procedures that don't jump right to the mind, and those include implant procedures. Now, obviously, everyone is familiar with the breast implants here, but we also do.
Show
Sure,
what the
I'd be
breast
glad
is?
to. So here's a couple of different style of breast implants here. These are very popular, not only for young women who have small breasts and wish to have a larger breast appearance, but also for women that have had children, maybe breastfed, and want to restore some of the perkiness they had, probably part of a mommy makeover. Implants that may not be as well known to your viewers include implants such as this is a calf implant, which is popular in men and women for enhancing the calf profile. This implant over here is a pectoral implant for men wanting to get a more muscular pectoral definition. And this implant here is one that's quite popular now and has been for a number of years. This is a buttock implant. It's not the only way to enlarge the buttock. The Brazilian butt lift, which uses a patient's own fat, is probably the most common way, but these are also important as well, especially for people that are thin.
Great, great. So is everyone a candidate for plastic surgery, and if not, why?
Well, like for almost any surgery, everybody is not a candidate. Most people are. There's being physically fit for that, and we would assess that before surgery to make sure you're healthy enough to undergo the surgery and the recovery as well. There's also financial fitness. Cosmetic surgery is not covered by insurance. It is a procedure one has to pay for out of their own pocket. And so, we give patients an estimate and talk to them about payment options so they can be financially fit. And then the mental state, emotional fitness is very important. We look for patients who have unrealistic desires. We even look for signs of a thing called body dysmorphic disorder. So that's the way that we assess if you're mentally, physically, and then, of course, financially ready for this.
Okay, great. So thank you, and now we're going to take some questions from our audience. If you are joining us, we've been speaking with Dr. Craig Person again, who's a plastic surgeon with the University of Maryland Capital Region Health Medical Group. He's been answering questions about how to get your best summer body. We invite you to submit questions right now during the live segment again by submitting a comment below, and please let us know you're watching by liking our Facebook video or liking our Facebook page. Are there any questions from our audience?
Yeah, here comes one now. What are realistic expectations for surgical improvements before the summer? How many inches is it safe to remove if I'm having liposuction?
That's an excellent question. We always caution patients not to think so much in inches. There's no question that if you enhance the breast with a breast implant, or if you enhance the buttock with a buttock implant or your own fat, there's no question those dimensions will go up, and you could measure that in inches. But I like to say to patients is that if you look at patients that I've operated on, and you look at the before and after pictures, the before and after dimensions, and the before and after weight, the least significant and impressive is the weight. The pictures are by far the most impressive, and that's because it's really body contouring surgery. So when we meet with the patient, we'll sit down and help them form realistic expectations. Most patients really come with realistic expectations, but occasionally we'll have to taper some down. But certainly as we look at the beach season coming up in the next couple of months, getting a narrower, tighter abdominal area, reducing some excess fat deposits along the back areas, especially in men, the love handles that everyone knows. And then, of course, enhancing buttock and breast appearance. Those are all reasonable expectations to achieve for the summer.
Okay, here's another one. If I were to undergo a cosmetic surgery such as a breast enhancement or buttock lift, how long do these procedures tend to last?
It's interesting. I know today we're talking about body contouring because obviously the warm weather is right around the corner. I also do facial procedures. When you do facial procedures, the duration of the results are sometimes measured in 7 to 10 years. But body contouring can last a long time. For instance, if I started my practice over 20 years ago, I have patients at that time that I did tummy tucks on that are now coming in to consult for facelifts. If they've been able to maintain their weight relatively well, their results almost look new. I mean, it's really stunning. So these are long-lasting results, which again, if you maintain your body weight, you should carry for, I would say, easily 10, 20 years.
Okay, here's another one. I'm done having kids. Tell me about this mommy makeover. What does it entail and how long does it take?
Great question, and one that we get a lot of. Basically, the mommy makeover, in most senses, involves two components. Something to make the breasts more youthful, and also the abdominal area. Now, in some patients, you might also do a little additional liposuction, but the tummy and the breast are the two main areas. Most patients are going to have a breast implant used, but not in everybody. We might just lift the breast without an implant. A lot of times, breastfeeding and having children will change the breasts enough that if we're going to lift, we have to use an implant. But using an implant or a lifting or a combination of both is used to make the breasts perkier like they were before they had children. And then for the abdominal area, sometimes you can get away with liposuction, but usually it's going to require an abdominoplasty, what we call a tummy tuck.
Okay. Oh, here's another one coming in. I only hear about doing liposuction on thighs. What other body parts can you use liposuction on?
You can actually liposuction many areas. The arms is an area that's done frequently. Of course, the abdominal area and the back area are probably the most common. Liposuction is a component of the Brazilian butt lift. The Brazilian butt lift is a surgical procedure where a man or a woman would take fat from where they don't want it, usually the tummy and the back area, the love handle areas, and then inject it into an area that they do want it, which in most patients would be in the buttock area, but sometimes it's actually into the hip areas to give a little bit more hip definition. So when getting that fat, we'll liposuction the arms, the thighs, the stomach, the back. You can liposuction the calves.
Can you do double chins?
You can. One of the issues with any time you're doing liposuction, in order to be a good candidate, you need to have good skin elasticity. So, for instance, in myself, if I were to liposuction my chin, it would not give me the result I need because I don't have the skin elasticity I did when I was younger. So if a person comes in their 20s and they have a full chin or a double chin, then liposuction is good for them. Now, I would say even into their mid-30s. But you start getting somebody into their 50s and later, and then you're most likely going to need to do a tightening procedure, either alone or also with a little fat reduction.
Do we have one more question?
We do. So it's March. What can I do now to be sure that I'm fully healed by June?
You know, it's a great question, and it's very timely. One of the sad things that happens sometimes is we'll have a woman show up, let's say in the middle of May, and she says, I'm all excited, I've been researching this, maybe I've been referred to you, and I feel very confident, I really want to move ahead with this. Most board-certified plastic surgeons like myself are going to have a pretty full schedule. We're already filled up for about 6 weeks. And so this is a perfect time because it's going to take a good 6 to 8 weeks to you recover to the point that you not only look good, but it's natural, it's not obvious to other people, you're able to move freely. It also gives you enough time to get on the surgeon's schedule. So I would say to your viewers who may be hearing this and thinking about this, go ahead and consult with your doctor now. Get an idea if you like the doctor, what his schedule is, and if you can move expediently, you'll be ready to go as soon as the beach season starts.
So if they get it done now, by August.
By June. By June.
Okay.
They should be ready by June.
All right. Well, if you want plastic surgery now and to look great for the summer, now's the time to do it.
Definitely.
So I have one more question,
Sure.
Dr. Person, and the last is, how do our viewers go about making an appointment with you if they wanted to?
Absolutely. The best way to do it is just to call our office. The phone number is 301-982-0202. And one of our patient care consultants will make an arrangement for you to consult and meet with me, and you'll meet the staff as well.
Thank you. So thank you for your time today. And
Thank you, DeAndre.
We've been speaking with Dr. Craig Person again, who's a plastic surgeon with University of Maryland Capital Region Medical Group. If you would like more information on our program, please visit umcapitalregion.org. Again, that's umcapitalregion.org. And thank you all for watching today.